Hey y'all, welcome to the Health Insurance Insights Network. I am Donna and I am here today because we have a problem. Today I had a patient who called in and he was inquiring about his copay for a radiology service. The copay in question was $250. Now, it was with a Medicare replacement plan, and the patient kept trying to tell me that he did not have a copay. This is a recurring issue. It happens probably every day. For whatever reason, Medicare recipients do not understand that the Medicare Advantage plan is a replacement plan. Every time, and I kid you guys not, every time I have this conversation with them, they say, the Cigna is my primary plan and Medicare is secondary. I don't understand why you're asking for a copay every time. So now I'm wondering, what are they being told when they elect to choose a replacement plan? Because this is causing a lot of frustration for those patients. So if you are a broker or an agent, just hit me in the comments and just say, hey, Donna, we do explain the difference to them, because I really feel like they don't get it. So I'm going to try my best to explain what the difference is. What the difference is. What you're seeing right now on the screen is a traditional or original Medicare card. This is original Medicare. It is the red, white, and blue card. This is the card you use when you do not have any other plan. This is your Medicare card. And the thing is, everyone, you get this card regardless, because this is your Medicare card and your Medicare number is on this card. However, what you see on the screen now are replacement plans. What I have here is United Healthcare, Medicare, Aetna, Medicare, Cigna, Medicare, Humana, Medicare. There's also other Medicares. There's Anthem Medicare, Clover Medicare. But the key item that I want you all to understand is that the Medicare Advantage plans that you see on the screen are replacement plans. They are not secondary, or I guess primary, and then you still have Medicare secondary. This is your Medicare plan. Okay? So I'm going to try my best to break this down, to see if I can help you all to understand exactly what you signed up for. And especially because open enrollment for 2026 opened on October the 15th. You have until December the 7th, it may be December the 8th this year, to elect the plan. And I want to make sure you select the best plan for you and that you understand what you signed up for. I I did not plan to do this today, but as soon as this situation happened, I was like, okay, I cannot go to sleep tonight until I figure out how to explain this. Key item, Medicare Advantage plans replace original Medicare. Original Medicare is Part A and Part B. Part A, your, I'll say inpatient, so hospital and inpatient services, and Part B, your outpatient services. So when you go to your primary care appointments, your specialist appointments, when you have outpatient surgeries, when you have any radiology services, any diagnostic testing at all, any labs, that's going to be under your Medicare Part B outpatient. I'll create another video so that we can dive into that, but for right now, what I want you to understand is what you see on the screen. Medicare Advantage plans replace original Medicare. You do not have original Medicare benefits once you choose to have a Medicare Advantage plan. It operates a little bit differently, and I'm not sure what the disconnect is. I understand, that patients are always switching replacement plans, but I just need, and it is my hope, that you understand what you're signing up for. I just feel like y'all don't know what you're signing up for. All right, so key item, you do not have two insurances. You do not have two insurances. Medicare does not pay second after your Medicare Advantage plan. That is not how this works. Not at all. Today, when I was talking to the patient, he kept saying, but it's 80-20. Medicare is 80-20, so I don't understand. It's, second to the Cigna. Medicare does not pay second after your Medicare Advantage plan. Your Medicare Advantage plan replaced your original Medicare. So things work a bit differently. There is no secondary billing to original Medicare when you have a replacement plan. Now, you can have original Medicare and a supplement plan that operates a little differently. You can have original Medicare and an employer-sponsored retiree plan. That operates a little differently, but it is not the same as a Medicare Advantage plan. A Medicare Advantage plan is Plan C. It is option C, and it replaces the A and B option when you elect it. Now, as a provider, we are only billing the Advantage plan when you have Humana Medicare, United Healthcare Medicare, Anthem Medicare, Aetna Medicare, Cigna Medicare. We are billing Cigna, Anthem, Humana, not Medicare. And that tends to be causing a lot of confusion. But I just key point here is you do not have two insurances. You do not. When you come to the office to see us, you do not need to bring both of those insurance cards. I mean, if you do, I'm going to keep a copy of both of them, but I am only billing the Advantage plan once that's what you elect to have. All right, we're going to move on. I'm going to try to explain a few other things here. So when you choose a Medicare Advantage plan, you no longer are using original Medicare. I know I feel like I'm being just redundant and I'm just saying things over and over again, but you are no longer using original Medicare. The Part A and the Part B is out the window. You have elected to have Part C as your primary insurance, okay? Your Medicare benefits are now managed by a private insurance company that contracts with Medicare. Let me say that again. Aetna, Humana, Cigna, United Healthcare, Blue Cross Blue Shield, those are private companies that are contracting with Medicare. So your benefits are now being managed by them. Medicare is not managing your benefits. So your question would probably be, well, Donna, do I still have Medicare? Yes, you still have Medicare, but you're not using your red, white, and blue Medicare card. So yes, once you have your Medicare, you still have the red, white, and blue card. But once you elect one of these replacement plans, I call them replacement. They should just call them replacement and stop saying Advantage because it is very confusing. But once you select to have an Advantage/replacement plan, you're no longer using the red, white, and blue card at your appointment. All right? Okay, so we are going to try to tackle one more little area as it relates to the Medicare Advantage plans replacing original Medicare, because now you understand that you do not have two insurances. I think I've tried to be as clear as possible with that. You do not have two insurances. You only have that replacement plan. And you now understand that when you choose a Medicare Advantage plan, that things operate differently. And I am not going to go into everything that's different. It is a lot. And I think it would be way too much to handle in this video. Because my purpose here is just to help you to understand that you do not have two insurances. That's it. How coverage works under Medicare Advantage. 4 key points here. The private plan becomes your primary, meaning your Humana Medicare is your primary and only insurance for Medicare covered services. One more time, it is your primary and only insurance for Medicare covered services. Okay? You must follow the plan's network rules. They're very different from original Medicare. They have a couple, well, not a couple, they have many different guidelines for you to follow, okay? Services now require prior authorization before approval. This isn't all services. And some of the Medicare plans for select services, they don't require either. But the plans, because they are managed by private companies, they get to elect which services require an authorization by them. Okay, so those radiology services, those medications, surgeries, they have guidelines and they pick and choose based on whichever plan you have, whichever MCO it is, which services they are going to cover and which services are going to require an authorization. All right. The other thing is that costs such as copays and deductibles are set by the plan, not Medicare. Medicare no longer sets these services. Now, I will tell you, I have seen that a lot of the plans do not have the deductibles. However, because it is insurance, because it is now managed care, there are so many variables in that. I've seen where some of them are 80-20, where some of them are 90-10, but you also have copays to see your doctors. Sometimes it's a $10 copay, sometimes it's $35. The plan gets to choose, not Medicare. So it operates very differently than what you may be used to if you were only using original Medicare or if you had original Medicare and a supplement. I will tell you that the patients that I see who are the most confused are the ones who had original Medicare and a supplement plan, and then they switch over to a replacement plan, because usually when you have Medicare and a supplement, you're not spending a lot of out-of-pocket outside of premium. But when you have a Medicare replacement plan, that changes everything, and you do end up spending some out-of-pocket. This open enrollment season, the largest tip that I can give you guys is to check your services. Maybe I'll do a video where I kind of walk through it with you, but I want you to check on those radiology services to see what they are saying you have to pay. Sometimes it's a range. It may say between 0 and 250, or it may say 200 or 325. But those numbers are there, and they are there from the beginning. I do always instruct you to call the insurance company if you are not sure about a copay. That information should be in your portal, but if you're not comfortable using the portal, just reach out and give them a call. All right, now just moving on, one last key thing, very important items that I want you to remember. All right. So original Medicare, the government pays, if you have original Medicare, the government pays your doctors directly. Okay, so that is only if you have original Medicare, then the government is paying your doctor directly. Now, if you have elected to have a Medicare Advantage plan, then the government is paying a private insurance company. Aha! Did you hear that? Private insurance company. That is your Aetna. That is your Blue Cross Blue Shield. That is your Humana. That is your Cigna. That is your United Healthcare. The government is paying them to manage and approve your care instead of them directly paying your doctors. So hopefully this helps you to understand that once you elect to have a Medicare Advantage plan, you are no longer using your original Medicare. All right? Now, just as a rule of thumb when it comes to the card, if you have a Medicare Advantage card, you're going to use it at your appointments. Take it. If you have an original Medicare card, you can still take it. However, that is for your records. If you give it to your providers, it is for their records. And I will be honest, as a provider, it is a very, very helpful record, because when you all are going through these periods of open enrollment, it is having that information helps us to figure out if you changed your plans. And it's a wonderful tool in January. But just to reiterate, having that original Medicare card, we don't use it to bill anything if you have a Medicare Advantage plan. So I hope this helped you all a little bit to understand that you do not have two plans. You do not have two insurances. Once you select a Medicare Advantage plan, you have one insurance that is your primary insurance, and it is your only insurance. Medicare is not secondary to them. Medicare is paying them to manage your plan. Okay? All right. So if you find this helpful, subscribe, share this video, because it is open enrollment season, and I do want as many people as possible to get this information, just so that when you all are making those decisions about which plan to choose, you understand the difference between having original Medicare and a Medicare Advantage plan. All right. Thank you for watching. Have a good one.